Move on. Sandhya J, she's the Group CFO at Narayana Health, joins in to talk about their numbers, which have been an excellent set, in fact. Sandhya, morning. Great to have you on the show. What a strong performance. Did the surgical volumes go up, and do you expect this really to continue? Where did the kicker really come in from?
Good morning. Thank you for having me on your show. So I think it is a mix of multiple events. One, of course, we were recovering from COVID, and therefore some of the demand which was muted because of the waves which were coming on and off, I think some of that came back. Our new hospitals started performing as well. So our 3 new hospitals recorded their highest ever revenue this quarter. So there is some kicker that came in from there as well. And I think across the board, across all hospitals, we saw good growth.
So can I say it is the first quarter of real normal business? Because every time we've spoken to hospital companies in the past, it's about the first wave, second wave, multiple challenges in terms of bed availability and the ARR.
To some extent, yes, but there are a couple of caveats there. One is that our Cayman business did see the impact of strict lockdowns because of COVID. So while India, yes, Cayman had the second wave, and a lot of patients postponed surgeries, but more so, a lot of our medical staff got isolated because of very strict quarantine rules in Cayman. So to that extent, there is some sluggishness in our Cayman results in this. And secondly, also, April was little muted because we were still coming out of the previous wave, and also there was a little bit of heat wave in the north. So April was slightly muted, but then a good recovery happened in May and June.
Broadly, has the medical tourism business also stabilized? Because that, in a sense, has been a mainstay, at least for big hospital chains.
So for us, we recorded our highest ever international patient traffic post COVID. So it has not gone back to pre-pandemic levels, but we had about 6.5% of India business coming in from international patients. But we don't believe we will reach our pre-COVID numbers for a few reasons. One is that as a matter of policy, we've cut off all referral arrangements with brokers and intermediaries. And as you are aware, the brokers and intermediaries hold a substantial market share in the referral base. And it wasn't falling in line with our value systems. And so therefore we cut that off. We are restricting ourselves to few markets where we can do a direct engagement model. And also a lot of our marketing effort is getting focused on domestic activities and digital activities, which are less prone to travel disruption. So I think we've made good headway in our international patient volumes, but we are not sure if in the short term we will return to our pre-pandemic levels.
How has this entire expansion of health insurance changing or challenging your business model?
So I think you're talking about private health insurance, or you're talking about government health insurance schemes?
I think private would be more relevant for you because in the private sector post-COVID, we know that Indians have bought into more health insurance, which means that they want premium hospital care.
Yes. So our volume of cash and insurance patients have been showing good positive trends. And in a way, this insurance coverage helps more people gain access to healthcare. So it has been moving in the right direction for us. Definitely, the place where there is still more work to do is in the government insurance schemes, because while they do cover a good ambit of people, and therefore healthcare becomes accessible, the system still needs maturity, both in terms of the realizations as well as in terms of the payment timelines. So there is a little bit of struggle we see there. But I think overall this awareness that there has to be more insurance coverage is more than helping hospitals. I think it's helping patients get the right care.
Uh, let's also understand what potentially is the challenge. The challenge is that cost of medical is going higher. Drug prices are coming under control. In the past, we've seen that certain surgeries and certain surgeries, there was a price cap which happened, knee surgery, cardiac care. Is that a challenge for a private hospital? Because when the cap on the cardiac care and the hospital stunt was announced, that had a huge impact on your balance sheet. Now that inflation is coming back, pharma companies have been forced to reduce prices. Could that be a challenge for hospitals also?
So when there is a sudden unplanned announcement in the short term, it does put people through a certain level of pressure on how to manage. But eventually, the benefits of efficiencies have to kick in, and end of the day, we need to be able to deliver care to the patient at the highest quality, at the most optimal or the lowest possible cost. So therefore, I think when some of these regulations come, the transition and how we work through the change management during that process, I think that becomes the bigger challenge. The second is when governments are making these changes, they should be consultative with the industry, understand our challenges, work with collaborative models on how we can solve some of these issues, so that overall we are able to bring a cost of healthcare down. In fact, I do want to, it's a slight detour, but I do want to call out the GST introduction on room rent. It is just it's a little bit ad hoc, very difficult from an operational implementation point of view, which most hospitals have spoken in multiple forums, but also it just suddenly increases the cost of healthcare for patients. So I think if we are able to work in a more collaborative fashion in terms of when some of these changes come through, then we can find solutions that are win-win for the patient as well as for the hospital.
Indeed. Such a pleasure having you on the show today, Sandhya. Great to speak with you. Thank you so much for taking the time out.
Thank you. Thank you for having me. Thank you.